Hello friend, greetings. After the successful learning through the first two modules of Uniforeva Eskool, we welcome you for the third module of Uniforeva Eskool on stroke, in which we will going to learn about stroke by its definition, different types and its effects on the brain and the body part. My name is Prabhakar Jha and I represent the sales training team of Uniking. Let us understand the stroke by numbers. Huge number of patients, near about 8 lakh patients, suffer from new or recurrent stroke each a year. Stroke is the fourth leading cause of death in India, and in every 6 minutes someone suffers from stroke. Up to 80% of stroke can be prevented if we act fast. If we able to reach patient fast to the hospital, we will able to save his life and his quality of life. Now, let us move and understand the stroke by its definition. Stroke is a medical emergency in which blood supply to any part of the brain is interrupted or reduced, and there is a lack of oxygen in the brain and its tissue. It is also known as cerebral accident or disease or cerebral infarction. Let us move and check and understand the different types of stroke. The first type of stroke is ischemic stroke. As you know, the word ischemia means an inadequate blood supply to an organ or a part of body. Here you can see also in the picture there is a normal arteries, then there is a clot formation in the arteries, and when its arteries is fully blocked, the higher possibility a patient suffer from ischemic stroke. So ischemic stroke occurs as a result of an obstruction within a blood vessel supplying blood to the brain, and it occurs and accounts for almost 87% of all stroke cases. Ischemic stroke is further divided into thrombotic stroke and embolic stroke. In thrombotic stroke, as you can clearly see in this picture, a blood clot, which is also known as thrombus, form inside one of the brain arteries. The clot blocks the blood flow to a part of a brain. This causes brain cell in that area stop functioning, and that will lead to die quickly. Another type of stroke is embolic stroke. It is also caused by a blood clot. However, in embolic stroke, the blood clot forms somewhere else in the body. It then travels through the bloodstream to the brain artery. At the first, it can be impossible for a doctor to determine which type of stroke a person is having. That is because the symptom can be identical in both type of ischemic stroke. Let us move and understand the second type of stroke, that is hemorrhagic stroke. As you can see clearly in this picture, a hemorrhagic stroke occurs when a weakened blood vessels rupture and there is a formation of aneurysm, and these aneurysms may rupture, which will lead to hemorrhagic stroke. Hemorrhagic stroke is more common in the patient who is suffering from hypertension, or any patient who suffers from traumatic brain injury may have hemorrhagic stroke. Hemorrhagic stroke is also divided into two types, that is intracerebral hemorrhage, which is also known as ICH, and subarachnoid hemorrhage, which is also known as SAH. Let's move and understand what is intracerebral hemorrhage. Intracerebral hemorrhage is a type of stroke caused by bleeding within the brain tissue itself, and it is a life-threatening type of stroke. Patient may lead into the coma and unconscious state for longer time. In subarachnoid hemorrhage, it refers to the bleeding within the subarachnoid space, which is the area between the brain and the tissue that covers the brain. The subarachnoid space is the space where the cerebrospinal fluids also circulates, and it's responsible for protecting your brain from injury by serving as a cushion. A hemorrhage in this space can cause a coma, paralysis, or even a death. Let us move and understand a most ignored type of stroke. The most ignored type of stroke is known as TIA, that is transient ischemic attack, which is also known as mini stroke. As you can see clearly in this picture, if you have a sign of a stroke that does not last long, is called transient ischemic attack or mini stroke. It usually lasts from 5 to 15 minutes with no lasting symptoms, and a TIA is often a sign that you may have a major stroke in the near future. The symptoms of the strokes are totally dependent on which part of the brain is damaged. As you can see clearly in this picture, if it is a right brain injury, it will going to paralyze your left side, and if it is a left brain injury, it will going to paralyze your right body part. And we also know the different parts of the brain is involved in the different functions of body. As you can see, the frontal lobe is always considered being a part of taking care of emotion. The cerebellum is also known for balance coordination. So in stroke, all these function affects which lead to the poor quality of life. Let us move and revise all the learning at a glance. Stroke is a sudden death of a brain cell due to lack of oxygen, which is caused by blockage of blood flow, rupture of arteries to the brain. We also seen the different type of stroke, that is ischemic stroke and hemorrhagic stroke. Ischemic stroke is also divided into two types, that is thrombotic stroke and embolic stroke. And hemorrhagic stroke is also divided into two parts, that is intracerebral stroke and subarachnoid stroke. There we also seen the TIA or the mini stroke, which is also considered as a warning sign to prevent all future strokes, and which provide if we control all these warning signs, we will lead a good and healthy life. And we seen also, if any injury occurs to the right side of the brain, it will going to paralyze your left body parts and its function. If any types of injury occurs in the left side of a brain, it will going to paralyze your right body part and its function. I hope this will going to clear your doubt about stroke by its definition, types and the body part it affects. Have a happy learning, and we will meet in the next module to understand more about stroke.